Here's the deal. We've all heard about this. Lots of posts all over Twitter and Facebook claiming that the CDC quietly updated the COVID number, admitting that only 6% of all deaths recorded were actually from COVID. This was shared and retweeted by literally thousands of people, including our president.
And by the way, I saw a statistic come out the other day talking about only 6% of the people actually died from COVID, which is a very interesting, that they died from
Well, they had comorbidities, which you've gotten criticized for.
The result? Now, thousands of people actually believe that the CDC messed up and that the pandemic has been horribly overblown. This is why this claim is not true. Let's go to the actual CDC website where this data is published. If you go to Weekly Updates and then click on Comorbidities, you can indeed see that it does say, for 6% of the deaths, COVID-19 was the only cause mentioned. Now let's go a bit further down to see how they got this. And it says, the data are based on death certificates. Now many of us haven't actually seen a death certificate and don't know how it's filled out. So here's a standard form provided by the CDC. In the cause of death section, we can see that part 1 is the chain of events that directly caused the death. In here, the physician or medical examiner responsible for filling it out must list the conditions leading to death, with the last one written being the underlying cause, or as they define it, the disease or injury that initiated the events resulting in death. Now that's a bit vague, so let's look at an example. In here, the immediate cause is listed as aspiration pneumonia, with the underlying cause of death being a motor vehicle accident. This means that this person got into an accident which caused blunt force injuries, which caused complications of coma, which ultimately caused the aspiration pneumonia that led to death. Pretty clear. Now in part 2 of this section, providers should also write other significant conditions contributing to death, but not resulting in the underlying cause in part 1. And this is where the underlying conditions come in. This is another example. Here, this person died of rupture of myocardium due to a heart attack, but they also had diabetes, COPD, and smoked. Even though none of these things were directly part of the chain of events leading to death, of course there were contributing factors. Simple logic. Now that we understand that, let's look at how death certificates of COVID patients might actually look. There is actually a whole document from the World Health Organization giving international guidelines for coding COVID-19 as a cause of death. According to their definition, a COVID death is a death resulting from a clinically compatible illness in a probable or confirmed COVID-19 case, unless there is a clear alternative that cannot be related to COVID disease. Also, which is very important, there should be no period of complete recovery from COVID-19 between illness and death. In this death certificate, COVID-19 caused pneumonia, which led to ARDS, which led to death. Typical sequence of events for COVID-19. Here are some more examples with comorbidities included. This person had 5 years of coronary artery disease, type 2 diabetes, and COPD. Now, for those of you who think that all deaths, no matter what they are, get misclassified, the report also provides examples of deaths that are not due to COVID-19, such as this one. This person got into a motor vehicle accident and they happened to have COVID-19. In this case, COVID is included because it might have aggravated the consequences of the accident, but this is not actually counted as a COVID death. Now that we've seen how death certificates work, let's go back to the data. First of all, this is not news. The CDC has been publishing these data since February 1st and, in many opportunities, has made clear that people with comorbidities had a higher risk of severe COVID-19 disease. If you read further into the introductory paragraph, you can see it says, Table 3 shows the types of health conditions and contributing causes mentioned in conjunction with deaths involving COVID-19. There were 2.6 additional conditions or causes per death. Now, what in the world does this mean? Remember that COVID death certificate and the whole chain of events written in part 1? In that 94%, they are counting both health conditions and contributing causes. This means that even the symptoms or conditions caused by COVID-19, such as ARDS or pneumonia, are counted towards the 94%, even if there are no comorbidities. You can see it here on the table. lots of people, including categories like pneumonia, ARDS, respiratory failure, and respiratory arrest, which are symptoms of consequences of the disease itself. Then, we've got the actual comorbidities like hypertension, cardiac arrhythmias, heart failure, diabetes, obesity, Alzheimer's, and a whole bunch of other conditions that a person who got COVID-19 might have. And they're not necessarily deadly, by the way. So in reality, that 6% that everyone's freaking out about most likely means that those death certificates were incomplete because the certifiers only wrote COVID-19 on it and didn't give the complete sequence of events. Bottom line is, even if someone had a comorbidity, many of these people would have lived many more years if they hadn't gotten sick with COVID-19. You might know people with diabetes or asthma who go about their lives normally. The fact that the vast majority of reported cases listed comorbidities doesn't make the pandemic less real. It only shows that people with pre-existing conditions are more vulnerable. Again, this should be no surprise, as it is true for many conditions we know today, such as cancer or HIV. If you still don't believe me, we can look at another piece of evidence, which are the excess death reports. These are the deaths that occur above the average or expected pattern for a time period, and it normally indicates that something really bad happened during that period, like a famine or, well, a pandemic. If we look at the data from previous years, you can see that the US has a pretty consistent pattern of yearly deaths, almost like a sinusoidal wave, increasing in the winter and decreasing in the summertime until, boom, come spring and summer 2020, and the deaths, instead of decreasing, increased dramatically. Coincidence? I don't think so. Now, there have been many reports analyzing this evidence, such as this article in the Journal of the American Medical Association, an internationally recognized peer-reviewed journal, that analyzed excess deaths from March to the end of July 2020. They concluded that during this period, there have been a 20% overall increase over the number of expected deaths in the US. So, in places not overly affected by COVID-19 like Michigan, they only had a 22% increase, while the most affected states like New York, Massachusetts, and New Jersey saw up to a 65% increase in excess deaths. If we talk numbers, they reported 225,530 excess deaths, of which 67% were attributed to COVID-19. This means that 2 out of every 3 deaths was a COVID-19 death. In another report released by the CDC itself, analyzing data from January 26 to October 3, 2020, they estimated 299,028 excess deaths. And again, they observed the same trend that 2/3 of deaths are attributed to COVID-19. And for the skeptics out there who are asking, what happens to the other 33% of deaths? Well, both articles report that death rates for other diseases like heart disease and Alzheimer's have also increased. Now, these could be normal deaths caused by those diseases, but how could we explain an unexpected and sudden rise in deaths above the historical average happening right at the same time as a global pandemic? Just in terms of probabilities, these excess deaths could also very well be unrecognized COVID deaths or even deaths among uninfected patients suffering disruptions from the pandemic. Imagine a patient with chest pain who is scared to go to the hospital to avoid getting the virus and then dies of a heart attack. Not a direct death from COVID, but it's definitely the pandemic taking lives in other ways. Also, if you really still believe that COVID deaths are inflated, just remember that the COVID-19 data we see right now might actually be lower than the actual number, because mortality data usually has significant lags as different states report at different times. In the end, what matters is that both death certificate data and excess death data are consistent with COVID-19 taking a huge toll in the US, as opposed to what the Facebook posts and tweets claimed. Don't believe yet? See it for yourself. All the sources are in the description. Please share the video and don't forget that arguments are always welcome as long as they're based on well-interpreted scientific evidence.